Now, this is a capillary in cross-section, and this is stylized. This is a red blood cell, and red blood cells constitute 25% of the cell mass of your body. And this is a capillary with all the fancy anatomy you got tested by in the first year of histology. Is capillaries should pulsate with the heartbeat. They're not non-functional. They actually pulsate with the heartbeat. When a capillary pulses open, it is 10 microns in diameter. When the heart relaxes and the capillary closes, it's 5 microns in diameter. A red blood cell is 8 microns in diameter. So the cell starts to go down the vessel. The vessel can't pulsate. The cell gets stuck, and right beyond that, you have a little tissue damage. What happens as we age, as that snowball goes downhill, is sugar coats the inside of this endothelium and begins to stiffen it, just like melting caramel over an apple. It also coats the red blood cell, which you can measure a blood test called the hemoglobin A1C. That's a direct measure of molecular aging from sugar toxicity on the surface of the red cell. So the cell, as it ages, also stiffens, but red cells turn over in the body every 120 days. So we have a biological marker, a functional marker of glycation in the body, because you can follow patients to see if they're getting better by looking at their hemoglobin A1C, because circulation testing changes slowly. So looking at a vascular study, in my opinion, must test in a year or so, you're wasting the patient's money. But you can look at hemoglobin A1C every 3 to 4 months and see whether things are getting better or worse. This diagram I purloined from an article. My jaw hit the floor when I read the article. It was in a British journal called Neuropathology and Applied Neurobiology. The authors, Dr. Brown and Dr. Thor out of North Carolina, one of the medical schools in North Carolina, what he's showing is, and what they were studying was, a young person in the capillary beds, the capillaries filter through all the organs and supply the oxygen and nutrients. But as we get older, for reasons I'm going to get into in a few minutes, there's an attrition of the capillary beds. So this is younger, this is somewhat older, this is senescence. And this is why you see atrophy. For instance, very commonly on MRIs, you'll see the brain is atrophying. Well, why? Why is the brain atrophying? Because it's starving. It's not getting enough blood supply. It's like a farmer out at the end of the Truckee River distribution in Fallon when there's no water. It gets nothing. So the syndrome you see, high blood pressure, loss of memory, diastolic heart failure, is determined by the organ that's taking the hit. The underlying process, glucotoxicity, is the same process. It's just affecting different organs differently. This was a diagram in Dr. Brown's article that really got my attention, because when I saw this, my jaw hit the ground. I sent him a fax and said, do you mind if I use your diagrams and pictures in a paper that I'm writing? And he was all excited. He said, you actually read the paper? Yeah. And we got to talking for a little while. And what he did was, this is research, they were using a 3-dimensional microscope. And the title of their paper, they were looking at brain senescence, why people get senile. And these are capillaries in brain with a 3-dimensional microscope. And you can actually see, he called them string vessels. These are the capillaries that are dying. Look at this red cell just caught in this capillary. Because we're going to explain how that works in a minute. If you look over here, you can see a red cell stuck right in the aperture of this capillary. And that's the circulation that's dying over years to decades that's causing the atrophy of the organ. It also causes stiffening of the organ. One of the specific syndromes you can see with metabolic syndrome is leukoariosis, which is a mouthful. Most of us were taught in medical school, internship, and residency that as folks get older, when we see atrophying of the brain and we see loss of the gray matter, that's just aging. But now we're seeing on MRIs, we're seeing leukoariosis in teenagers. So this is not normal. And if you actually go to the PubMed search engine at the National Library of Medicine and you put in the term leukoariosis, you will find that the preclinical folks, they're trying to tell folks this is a very dangerous condition. This is not normal to have your brain scarring and shrinking like this. But doctors are taught that's what happens, so they kind of blow it off. I don't. When I see leukoariosis in an MRI, I get very nervous because we've been reversing memory loss in our practice for the last 10 years. And the sooner you can get to it, the easier it is to reverse. But basically what it looks like is, here's a little bit of it here. Leuko means white, ariosis means rarefication. That's where the word came from. because when they were battling on developing the terminology for ICD-10, there was no language for this, so they were going to call it ischemic paraventricular leukoencephalopathy. Well, if you can say that, you get a free drink at the bar, but then they come up with leukoariosis, and they mean the same thing. But here it's a little bit more advanced, and you can see it's around the ventricles, because it doesn't have to be around the ventricles. But you can see it here, and a little bit more here. Notice how here it's not around the ventricles. It's actually out in the parenchyma of the brain. And that's one of the interesting things. If you look at the science today about temporal lobe seizures, they will tell you that temporal lobe seizures come from lateral temporal sclerosis, which is leukoariosis in the lateral temporal areas, because we've reversed that in folks too with the EECP. Again, these are just additional pictures where you can see how bad this can get. And whether it goes from this to this, the radiologist will tell the clinician, and the clinician will believe it, well, it's all just normal. They're just getting older. Don't worry about it. My advice would be worry big time about something like this, because the sooner you get to it, the easier it is to stop it and reverse it. Here's just another angle where you can see the leukoariosis plaques. And again, notice it's not near the ventricles here. So the area of the brain that is affected will determine the clinical syndrome that you see. Just like if you get small vessel disease in the kidney, you'll get high blood pressure. If you get it in the heart, you'll get diastolic heart failure. Watch the echoes you order for diastolic dysfunction. That's a clear indicator the heart has small vessel disease and it's stiffening. If you get it in the brain, you'll either get small strokes. They're not going to be big strokes. They're going to be small strokes, lacunar infarcts, or you're going to get Alzheimer's-like dementia.